Alright, so we already made our arthrotomy. I'm going to put one of our retractors here in our notch. We can pull that like this. And another retractor in the medial gutter. You see our defect here is actually more oval or oblong. So traditionally this may be used with two overlapping circles in various formats to cover both of these this area of defects. This new instrumentation, we can make a new oval type dowel to make sure that we just have to take one dowel instead of having to overlap two. So we have different sizers here, different widths, 14, 17, and 20 millimeters in various lengths. And so we can use multiple of these to determine which one best fits the size of our defect. So that one covers nicely. Fits flesh onto the condyle. I've got bone on either side here. So I'm pretty happy with this fit. I'm going to make a couple marks on the condyle here. Yeah. So when I come back, I'm going to know, see that our defect is going to be contained in that. And once we confirm which side we're going to use, we can relax on our retractors. So now what we do is try to find the best location to match up the curvature. Okay, same thing here. There's our outline. First thing we're going to do is place our guide wire. On the inside there's a polyethylene peg in here to make sure that if we need to we can extrude the graft out of this cutter. But we're going to basically place the cutter down, we're going to impact it into this third laser line here. First going to get this aligned exactly where I want it. I'll make sure that it's flush all the way around, which it is. Okay, we ask someone then to drill our guide pin in.
So brains kind of a real thing. Was it goes to the 24 position and stays safe. The last line to spades. They clip.
And they're very cute.
And it's a team. Yeah, they go.
And making sure that I'm down all the way around. Down past the laser lines. Take our handle out. Now we have this device which will push on that polyethylene plug to help extrude the graft out. So sort of extrude the cutter from the graft, I should say. Now we can see our cut surface here with our graft. Okay, now this is the component of our undercutting guide. Let's put a saw capture on here. Our wings all the way around, we want to make sure they get impacted down so it's sitting flush. So that's on there. We'll take our saw through the saw capture. Now our graft is captured inside here. Carefully use our graft extruder. To gently extrude. And you remember this was my anterior position. Here's our graft. We have our template, our size template. And see how this fits. Feeling all the way around. There's a slight little bit of elevation on this side here, so I may take a little bit of bone off the bottom to make that fit. Otherwise, this fits fairly flush. do this with the rongeur or the saw.
Well, I don't know. I've got that never since the bench. And this is the osteochondral cricket. We're setting some out of that. The world, the other as well. Yes, I'll just go.
And just lining up the crowd part.
I'm having my bush. This is our workout.
So now we have a much better fit all the way around. So it's important to make sure that this fits properly. If the graft is circumferentially either a millimeter above or a millimeter below, we have adjustable reamers that can fix that. However, if it's asymmetrically off, you need to adjust that by hand. The last component here for the graft prep, same as for a single plug, we're just going to bullet the edges to make it a little easier for insertion. Transport medium to keep it hydrated and full of nutrients. All right, so next we're going to come back up onto our patients. Flush all the way around. We want to make sure it's flush both in the patient and on the condyle that's a donor to make sure that you get the best chance of a good fit. Very important not to torque on these wires so they go in nice and collinear. And this just cuts through the cartilage so we don't make a mess with the reamers and leaves the recipient cartilage of surrounding it nice and intact. We're just going to mallet this in about 2 or 3 millimeters through the covered surface. So outlined our defect. So now we have our size appropriate reamers and our guide. And so what this does is we'll put a guide up here, and this sets the depth against our depth stop here. Always want to make sure there's a +1 and a -1, so we want to make sure that those are appropriate. Clear debris from this part. And then what we do is just switch around the depth stops to the other side. So now we've made the 2 reamings at the ends of our defect. We have this ribbon amount of bone that goes in between. So now we have a box cutter that will go over again over the wires. This needs to be sunk until these depths are just flush with the cartilage.
They are really well done.
Drill out or remove our tissue remains. You can use out of this curette or freer to help remove this tissue. Now we have a dilator again. So line up. Bring it gently to start, let it find its home so you don't make a new angle. Here we can see the dilator fits nicely, it fits flush pretty much all the way around, so our implant should also fit flush. So at this point we should be prepared. Nice and smooth. We have our graft. We'll use our suture as a backup to make sure if we need to remove it for any reason, we've got some help to do that.
sterilize the history.
Something that you brought the standard within China, working with us true
Graft has been bulletized, so we have our orientation appropriately.
This is
And ideally using thumb pressure anteriorly here. So in a patient, what I might do is use the suture to remove this, hold my graft in place. Pull our suture out.
facility started at least like this two years.
Done. Here's the final process. Again, we'll do the same thing here. We'll close the knee back. I pin back the arthrotomy. Take the knee through our range of motion to make sure there's no bumps or kicks. And then irrigate the joint, fully remove all the bone debris, close your arthrotomy, and move on to the outpatient.
That was